Hello, everyone. It's Dr. Deborah Durst with Revitalyze MD. A little bit about me. I am a traditionally trained MD that has a specialty in emergency medicine, and I practiced 25 years, a long time, in the emergency department as a board-certified emergency physician, and then transitioned into my journey in anti-aging about 10 years ago with a passion now for aesthetics, wellness, and sexual wellness. And that's what we do at Revitalize MD. Today, during our podcast, I have a guest with me. She's a frequent guest, Samantha Addis, our office manager.
Hi, everyone. My name is Samantha. I am the office manager at Revitalize MD, and I work very closely with Dr. Durst on a daily basis with her patients. And my main goal is to make sure that patient care is top-notch.
All right. So what do you want to talk about?
So we get tons of calls, especially recently because it's an up-and-coming thing, on what CJC is. So we just go into what exactly CJC is and the kind that we offer.
Okay. And do they frequently ask about growth hormone too?
Yeah, it's always, what do you guys have growth hormone? And we always direct them to CJC.
Okay. So we'll talk a little bit about peptides again every time we're talking about peptides, and I think CJC, again, is one of my favorites, and a lot of our patients are on it because of all the beneficial effects. But I want to just talk a little bit again about peptides in case if you haven't heard any of the other peptide podcasts, that peptides are really just proteins, so amino acid sequences that are synthetic. So we're making them, but they are identical to a neurotransmitter or hormone that's naturally in the body. And so with CJC, it's actually CJC-1295. And frequently it's paired with epimorelin because they're considered growth hormone peptides. And so they simulate growth, a certain type of hormone in the body. So we'll go into that a little bit more. So CJC is a growth hormone releasing hormone. So it acts like growth hormone releasing hormone. So it's going to act on receptors in the pituitary to stimulate your own release of growth hormone. And it's frequently paired with epimorelin, which is a growth hormone releasing peptide, and that actually inhibits the negative feedback. And so that's complex, but basically it increases growth hormone too in the body. And so they're naturally stimulating your own release of growth hormones. So the big thing with the peptides, and sometimes they might ask for growth hormone, they sometimes will ask for CJC specifically, or Samorelin was a older one that was frequently used. So just some quick points about that. Samorelin is like considered a first generation growth hormone releasing hormone. And even it sometimes would be paired with epimorelin. And then CJC-1295 is a second generation, and tesamorelin is a third. And again, one of my favorites and frequently used is CJC-1295 with pairing it with epimorelin.
So what are some of the benefits of CJC?
All right, so basically, if you look at, again, CJC, just repeating that it's a growth hormone peptide. So it's increasing growth hormone in the body. So growth hormone peaks at 20 and then goes down over time. So if we're in our 30s, 40s, 50s, and beyond, we still have spikes of growth hormone that are being released, but they're low. And so they're not the size of the spikes that we had, not as high as the spikes that we had when we were 20. And so we want to increase that, and we can actually use these peptides to stimulate your own release of growth hormone and increase those spikes. Where if you're giving growth hormone, not in the peptide form, but in growth hormone, it's highly regulated, highly expensive, but it is like that because you're actually shutting down your own release of growth hormone because it is too sustained. And so it shuts down your own system. And so, if you look at testosterone, so as far as the benefits, like if you look at testosterone and all the benefits that does for men and women, it will increase brain clarity, so it decreases your brain fog, increases endurance, muscle mass, increases energy, decreases subcutaneous fat. It actually increases insulin sensitivity. It decreases your lipid or improves your lipid panels, increases libido. So the growth hormone does the same thing that testosterone does, but kind of like on steroids. So it does it a little bit better. And if it was a drug, which it is in the form of growth hormone, it'd be ideal because it has all these positive benefits. The unfortunate part about growth hormone as the drug is that it usually is too sustained and the actions are too long, and that's not how it is normally physiologically produced. So growth hormone has just a very short half-life, or the growth hormone releasing hormone, and the effects, because there's spikes and then they decrease. So basically it's more physiologic to use the peptides, but you get all the positive benefits of growth hormone without the drug growth hormone, and it does the same thing that testosterone does, but better. And so pairing it with testosterone is awesome, because then you really get to see body composition changes, which is another thing both of them improve.
So can you go on CJC indefinitely, or like growth hormone, is it something you can only do for a certain time?
That's a great question, because you really can't be on them indefinitely. You can, but you have to cycle on and off, because basically, to take a complex like scientific term and break it down in more simple terms, your receptor will get too used to growth hormone if it's constantly being turned on. So you want to cycle on and off of them. So frequently we're doing a cycle of 5 days on, 2 days off, so that if someone wants to continue indefinitely, they can. Some people will do like a 3-month and then come off of it for a month, and that's also cycling. So your receptor just never gets too used to it. But I like 5 days on and 2 days off. And there's certain ways we dose it, as you know. And then again, there's certain things that you don't want to do around the administration of them. But the nice thing about it is it's not going to, in the doses that we use, it's not going to oversaturate your receptor. So you're not going to get that sustained issue and in adverse effects that you would with growth hormone.
Okay. So are there any negative side effects with CJC or any toxicities?
Yeah, so basically, you don't ever want to use growth hormone in a cancer, in a active cancer. So I would apply that to the growth hormone peptides as well, and not use them in any active cancer patients. So you want to know the medical history. It's very important that you know where you're getting your peptides, just so everyone knows, because a lot of people will order these online, and I would highly guard against that. I would not recommend it, because you want sterile products. You want to know the purity of it. You want to know what you're injecting into your body, because these are injectable products. And so I would not just order anything online to inject into my body. So we use reputable big pharmacies, which are the only ones that are really producing peptides any longer. And so there's not really any adverse effects outside of that. You just don't want to use them in any cancer patients. In diabetic patients, you have to be careful just to make sure, that their blood sugars stay within normal limits. But again, most of the time, you're never going to oversaturate the receptor in how we dose it, which is good. And then toxicities, there aren't really any, again, when we're, respecting those contraindications for use in patients. And then you can get, local reactions. Again, they're all injectable. So we kind of walk you through in the office how to reconstitute, how to dose, and we dose it appropriately so that you're not going to run into problems. And then you could get little local reactions where you're injecting, but not too frequently. Yeah.
And is this one that you can use along with other peptides, such as BPC or any other peptides that we offer?
So you can use almost any of the peptides. You can stack. Some of them work, again, together to get the effects you want. And sometimes we're stacking them to get different results. And so, for instance, since we're talking about CJC-1295 and epimorelin, you can stack it with BPC, because CJC, I feel like with women in hormone optimization, once you have them hormonally optimized, you really almost have to use a peptide or a growth hormone peptide to really get those body composition changes that they want. Those changes we all see, the thighs and the subcutaneous fat, or behind the arms, or, the bra area. Those are common complaints with women, and it's pretty common with almost all women. Yeah. Hormonally optimizing doesn't quite get you there. I think that the growth hormone peptides definitely get you those body composition changes, but it really takes a good 6 months to see that. And then, so I think, though, that for executive brain function, in addition to getting people feeling optimal, I feel like men almost need that extra step of stacking BPC with it because it increases growth hormone receptor sensitivity. And so the CJC and growth hormone peptides work better. But say we're not using it synergistically like we are with CJC and BPC, we could have them on CJC for all the things we talked about, improving their brain and brain fog and energy and libido and body composition changes. But we could have them on like melanotan if they wanted to, tan, or, if they want better sexual function, we can have them on PT-141. And then you're doing different effects, but they're not necessarily improving the effects of the growth hormone peptide, if that makes sense.
Yeah.
But there's no reason because they're not drugs. And so when they're not drugs, you're not going to get the side effects and you don't get the interactions that you get with drugs. And so really what we're doing with peptides, which again, insulin was the first peptide. And so with that, what you're doing is giving the body back a signal it doesn't have or no longer has enough of, so that you can get repair or function that you did when you were younger. And you can actually use a couple of them, as we've talked in other podcasts with, inflammatory conditions or autoimmune conditions to help modulate that and get those conditions under control.
So is there anything else you'd like to let the people know about CJC?
I think the only thing that we kind of breezed over, and just to reiterate, is that these are injectables. Most of the peptides are. So again, you don't want to order those peptides from anywhere because you're injecting something into your body. So know it's pure. Know that it's not with other chemicals in it. So you want to know your sources. And again, we use big pharmacies. They do sometimes come in a powder that needs to be reconstituted. Most of them do, actually. And we'll walk you through that process in the office. And so you'll know exactly how to reconstitute at home if you want to after, and you'll know exactly how to inject and go home with the supply. So I don't know if we kind of breeze through the fact that they are injectables that you will use at home to get the effects that you're...
And they're small needles. You're doing it in an insulin syringe, so it's not a big needle. So that's not something that should scare people away.
They are. It is a very small amount. And so frequently you're just finding a small amount of subcutaneous tissue and injecting it in through an insulin needle. So it's very simple, not painful.
Yep. All right. Well, I think this was a great topic to let people know about what CJC is and what exactly peptides are. So if you guys want to follow along on our social media, we'll link those below. And if you guys also want to subscribe to our channel to get notified on our next videos or our next podcast series. So
go ahead and definitely click the bell, so that you are notified, make sure. And then put anything in the comments that you might want to hear about, because again, we'll dive deep into anything aesthetics, wellness, or sexual wellness, and aren't afraid to talk about anything. And we really want to revitalize your look, your health, and your sex life. So thank you. And thank you, Samantha.
Thank you.